Quick note, this is an automated educational summary of public medical sources, Mayo Clinic, the NIH, and MedlinePlus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. If you've noticed persistent joint pain, stiffness, or swelling, you might be wondering whether you need to get tested for rheumatoid arthritis. Here's what's changed. You don't always need a doctor's appointment to order an RA blood test anymore. In 2026, direct access labs let you order online, pay, and get results without a referral. Here's what Mayo Clinic and the NIH actually say about how these tests work, what they cost, what you should expect, and whether an online option is right for you. According to the NIH, rheumatoid arthritis is an autoimmune disease where your immune system mistakenly attacks the lining of your joints. That inflammation causes pain, swelling, and over time, permanent joint damage if untreated. It's different from osteoarthritis, which is simple wear and tear damage. RA can start at any age, but it's most common in women and typically develops between 30 and 60. The Mayo Clinic emphasizes that early detection and treatment can significantly slow progression and prevent the lasting damage that RA can cause. The Cleveland Clinic identifies 3 main blood markers doctors look for. First, rheumatoid factor, an antibody your immune system produces that shows up in RA. Second, anti-CCP antibody, which is more specific to RA than rheumatoid factor alone. Third, inflammatory markers like ESR and CRP, which measure how much inflammation is happening in your body right now. MedlinePlus notes, you usually don't need all 3. A combination tells the story. Not everyone with RA tests positive for rheumatoid factor, which is why doctors look at the complete picture. Test results plus your actual symptoms. Let's talk money. If you use insurance and go through your doctor, expect to pay your copay, typically $25 to $100 depending on your plan. Using an online direct access lab like Quest, LabCorp, or Everlywell without insurance? A complete RA panel runs $150 to $400. Many services charge a flat fee for the lab order itself, then you pay per test. Some offer upfront discounts if you pay in full. The bottom line? Online ordering is often significantly cheaper than an urgent care visit plus the test, which can easily exceed $500 to $800 total out of pocket. Here's the process. You visit a direct access lab website like Quest, LabCorp, or a telemedicine service that offers RA panels. You select the rheumatoid arthritis panel you want, answer basic health questions, pay online with a credit or debit card, and within minutes, you get a lab requisition PDF emailed to you. You take that requisition to any participating lab location. There are thousands nationwide. They draw your blood, which takes about 5 minutes. Results come back in your online account in 3 to 7 business days. No doctor's order required. Many services offer optional physician consultation for an additional fee if you want help interpreting results. The blood draw itself is quick and routine. A phlebotomist will check your ID, ask a few standard questions about medications and allergies, have you sit down, draw about 3 small vials of blood into labeled tubes, and you're done in under 5 minutes. There's usually no fasting required for RA panels, though some labs request you avoid certain blood thinners for 24 hours beforehand. Check your lab's instructions. After the draw, your blood goes to the lab for processing, testing, and reporting. You'll receive a PDF with your actual numbers, reference ranges showing what's normal, and a basic interpretation of each marker. Here's what the numbers actually mean. According to Mayo Clinic, a positive rheumatoid factor doesn't automatically mean you have RA. Some perfectly healthy people test positive. Anti-CCP is more specific to RA. A positive result is a stronger indicator. Inflammatory markers show your body's inflammation right now, but they can go up for many reasons, not just RA. Here's the crucial part. A diagnosis requires 3 things together: positive tests, your symptoms like joint pain and swelling, and a doctor's physical exam. MedlinePlus emphasizes that you cannot diagnose yourself from lab numbers alone. Always discuss results with a healthcare provider. Myth 1. A positive test means you definitely have RA. Not true. You need symptoms too. Myth 2. Online labs are less accurate than doctor-ordered tests. Both use the same equipment and standards. Myth 3. RA only affects older people. It hits adults of all ages, even young people. Myth 4. You can treat it without a doctor. Early professional treatment really does prevent permanent joint damage, so don't skip this step. The Cleveland Clinic confirms that while online testing is convenient for initial screening, a rheumatologist's expertise is essential for actual diagnosis and treatment planning. If your test comes back positive or abnormal, schedule an appointment with a rheumatologist or your primary care doctor. Bring your lab report with you. They'll review your results, take a detailed medical history, do a hands-on exam of your joints to check for swelling and tenderness, and possibly order imaging like X-rays. Early treatment makes a real difference in slowing RA progression. If your results are normal, but you're still experiencing joint pain, don't assume you're fine. A doctor can help identify what's actually causing your symptoms. Many conditions cause similar pain, and you deserve proper evaluation. Online RA testing is convenient, affordable, and a smart first step if you're concerned about your symptoms. Think of it as gathering reliable information before your doctor's visit. You'll walk in with actual data instead of just descriptions. The Mayo Clinic and Cleveland Clinic both emphasize that diagnosis requires clinical judgment, not just lab numbers. Your results are one piece of the puzzle. Testing online saves time and money, but it's absolutely not a replacement for professional medical care. If you're experiencing concerning symptoms, get tested, share the results with your doctor, and take it from there. What type of health tests are you interested in? Comment below and we will make a video about it.